This bone is our os coxa that forms our pelvic girdle. This is a fusion of 3 separate bones. The big one on the top is your ilium. Then you have this one that's kind of a small, relatively flat, which is your pubis or pubic bone. And then if I flip around, you have this surface right here, which is kind of a thicker one. It has a lot of bump on its surface. It's not as smooth. This would be your ischium. On the top, if you look at it, this surface right here, this is your iliac crest. Again, that surface that has a lot of kind of roughened surface you have, that's your ischial tuberosity. The big hole you have right here, where a lot of blood vessels and nerves pass through, that's the obturator foramen. And then this right here is where the head of your femur would fit in, and that's called the acetibulum. The next bone we have is our femur. So here's our femur. Again, it's a relatively large bone. It's actually the largest bone we have. So in the femur, you have your head, you have the neck, and then you have this kind of like a indentation, circular indentation right here, and I'm running my finger, and that would be the fovea capitis. You have 2 protuberance bone right here, one big one, one a small one, lesser trochanter, greater trochanter. Now, if I look at my bone as a whole, again, take the head always point toward the middle, so go down. So this would be the medial side, this would be the lateral side. This surface right here is my medial, again, medial condyle. And the little bump on the side would be the medial epicondyle. And then this side would be my lateral condyle. And the little bump on the side would be my lateral epicondyle. You're also going to have this space right here, which is called the intercondylar notch. The next bone we have that's formed the lower part of your leg is the tibia. So notice again, tibia is pretty thick. You have kind of a flat surface on the tibia right here. This is the proximal end of the bone, and this side is the end. So for the tibia, you have the tibial tuberosity right here. You have the anterior border. On this end, you have this, again, little bony piece that comes up. That's the little bumps you see on the side of your ankle. So this is the inside one, the medial one. And this is known as the medial malleolus. So take this one, if this is medial malleolus, then go to the other end. This surface right here on the top, that would be your medial condyle. And the opposite side of that would be the lateral condyle. The next bone we have is your fibula. So notice fibula is relatively thin, which means it is susceptible to fractures. The only thing you need to know for fibula is that it has 2 ends, kind of a chubby end, and the other end is more elongated. So the elongated is the one that forms the little bump on the side of your ankle that's larger on the outside again. That's the lateral malleolus. And again, the more round end of the fibula, that's the head of the fibula. You do have your foot. So you have for your foot, you have the bones that forms the ankle bone called tarsals, which are these bones. They're a total of 7. They're called calcaneus, talus, cuboid, navicular, and then these 3 are cuneiform. 1, 2, 3. They're actually called medial, intermediate, and lateral cuneiform, but you guys don't need to know those. Then going down, the sole of your foot are these bones right here. These are your metatarsal bones, starting with number 1 for your big toe, 2, 3, 4, 5 for your pinky. For your fingers, or sorry, more your toe bones, you have total of 3 for all of your toes, with the exception of your big toe. Your big toe, again, you only have 2 bones, kind of like your thumb. So you have proximal and distal. And for all the other 4, you have proximal, middle or intermediate, and then the tip of your fingers would be your distal phalanges. And then last but not least, you have this bone, which is the patella, that's your kneecap.